For many, the newspaper headlines this morning suggested the dreaded moment has arrived. Ebola has come to India. But is that the right understanding of the fact? A 26-year-old male passenger who was cured of Ebola in Liberia has tested positive after arrival in India? And secondly, how prepared is India for this worrying disease? My guests are the Chairman and Managing Director of Medanta Medicity, who will be joining us shortly, Naresh Trehan, former Health Secretary A.R. Nanda, Chairperson of the Centre for Social Medicine and Community Health at Jawaharlal Nehru University, Rajiv Das Gupta, and the Senior Consultant in Internal Medicine at Max Healthcare, Supriya Bari. Dr. Bari, let's start by trying to understand the precise status of the young 26-year-old man whose semen has tested positive for Ebola. Am I right in believing that he has successfully undergone treatment for Ebola and Liberia and has recovered from it? Yeah. But traces of the virus can linger in urine and semen for perhaps up to 90 days, which is what has happened in this case. So that means that this young gentleman doesn't have the disease, but his urine and semen still have traces of it.
No, as per the literature and as per the guidelines of WHO and CDC, the person has cured from the disease.
So he doesn't have the disease?
So he doesn't have the disease because he does not have any symptoms and he has been cured for the disease. But as we know that the virus can remain in the semen for up to 7 weeks or even 90 days, especially in the semen and the breast milk. The urine has not been specified, but they said that the semen and the breast milk are the two fluids, body fluids, where the virus can remain.
So then, given that he doesn't have the disease, are papers right to say Ebola has come to India, India has got its first case? Because this is a man who's recovered, yeah, and there has been no known experience so far of a relapse in any country.
Yeah.
So is it right to say India's got its first case of Ebola, or is it simply true to say something much less, that a man who's recovered has come, but there are still traces in his semen and urine which could continue for 90 days, but that's a very different thing? I'm just clarifying so that the audience knows.
Yeah, it's a different thing actually. The statement by saying that the Ebola has arrived to India, in a way it is correct and in a way it is not correct also. The Ebola has not arrived to India in the clinical senses because the person has been cured. But if this person goes to the community,
then there's a danger. Absolutely. I'll come to that in a moment's time. Yeah. Dr. Trehan, you're joining us by telephone. I'm clarifying first the precise status of this young 26-year-old man whose semen tested positive for Ebola. And the question I'm asking is this: given that he's been, we've lost Dr. Trehan at that critical point, let me put that same question to you, Dr. Das Gupta. Would you agree with the answer that we got from Dr. Bali, that in this instance, newspapers and the media are wrong in saying India's got his first case of Ebola? This is a man who's recovered, but as we all know, traces will continue in the semen and in the urine for 90 days, but that doesn't mean he's the first case of Ebola.
Yeah, in the public health sense, it's not correct. The correct position is, as she said, that that person will continue to have it positive in semen. If it were a woman, breast milk would continue to secrete Ebola for quite some time, and nobody quite knows when breastfeeding becomes safe. The point is that Ebola in that sense arrives in India when we actually diagnose the case and we notify it.
In India itself?
Yeah, this is a post-cured case.
This is a cured case?
Yeah. This is a cured case, going by the
So there is no doubt in both your minds, this is a man who is cured, he's recovered from Ebola. It's just that traces continue in semen and urine for 90 days.
Which is expected.
Which is expected. Let's move on from that point, Mr. Nanda. The young man was quarantined in isolation virtually on arrival at the airport, and he has been held there since. Does it therefore follow that there are probably no chances of him having infected anyone in India? Probably no chances.
Yeah, probably. But it is a matter of, I think, as a matter of abundant precaution, this is better to err on the side of overaction as it has been done. I think as per the guideline, as has been explained by both of them, both the doctors, I think that's a good step.
Absolutely. What you are saying is that there is probably no chance of this man having infected anyone because he was quarantined on arrival and has been held in quarantine since then, but one should always err on the side of caution. Now, I want to take that one step further with you. Is it the case that if all the medical and other staff dealing with this man have had proper protective gear, and in addition have known how to take all the necessary precautions, then they too would be safe?
Yeah, I think so. I think that protection, the way it is given to the medical staff, the nursing staff, is very, very, very important as far as I know. I think
Absolutely. So assuming that the people who are dealing with this person have taken all proper precautions and have proper protective gear, would you concur with Mr. Nanda
Yes.
that they are safe?
Yeah, they are safe.
Which means that in fact any sense of apprehension, leave aside fear and danger, created in the newspapers this morning by the report India gets its first Ebola case, those are mistaken if not exaggerated as well.
Yeah, to some extent, because as he said that, right, that it has to be positive, the case has to come positive by a laboratory in India, then only you can say the Ebola has arrived India in the right sense.
Let's then move on, and Dr. Trehan is back with us. Let's then move on, Dr. Trehan, to ask the question, how effective are India's preparations in handling Ebola? Now, first of all, how much credit do you give the authorities for testing this young man's urine and semen, even though on 3 separate occasions his blood samples had produced negative results? How much credit do you give them for going that one step further and testing his urine and semen before they permitted him to leave quarantine and come out into the general community?
Well, Karan, it actually is a compliment to the process that has been established to say if anybody is coming from that region, or in this case this gentleman had already contacted Ebola, although he had been declared treated, the fact that you screen yourself and make sure that the testing done in another place is actually accurate and valid till the date the person arrives, I think is a very good specified system that we have established in India.
So what
now,
you're
this
saying...
gentleman did come, so it's not a credit that he was detected. He came with a certificate saying that it's safe for him to travel and he is Ebola free. But the fact on the face value of the certificate, it was not accepted and said, let us test him. Now this is a very good alarm that has been set off for the whole country.
Okay.
So I think in a way what this has done is put everybody on alert without actually having the real danger.
Okay.
So unless, if you take this particular person, unless he had sexual relationship with somebody, he was not infective. But the fact is, today the newspaper and what you people have done in the media has brought it to center attention that there is a real live danger, ever-present danger, and we must be alert and we must test our systems.
Absolutely.
So the very fact that is being talked about, the very fact that you are on the show and other channels are also going to do it, is the fact, will actually put the pressure on everybody to be well prepared.
Okay.
And I can tell you that this is a blessing in disguise that this
Absolutely. But it will only be a blessing in disguise, Dr. Das Gupta, if the preparations we make are adequate. If the preparations turn out to be inadequate, it won't be a blessing and certainly not in disguise. So I want to now focus on how good or adequate is India's preparedness. So to begin with, the first check that India has is to try and screen all passengers coming in from Ebola-affected countries. At the moment, they're only required to fill a self-declaration form specifying whether they have any of the symptoms such as fever, headache, vomiting, bleeding. According to Priyanka Sharma, a passenger who flew in from Abu Dhabi and spoke to the Times of India this morning, there is no mandatory screening and there is no thermal screening. Is that a weakness in the checking system at the airports, or is that thermal screening unnecessary?
That's certainly a weakness, but a caveat to the first part, it's where the person is not arriving from, but where he's originating from. That's crucial. He may be originating from one of the Ebola-affected countries, but may be coming in via London.
Unfortunately, you don't know where he's originating from, because if he's coming via London, he may have been there for 10 days. The documentation won't show. Which is why, if you have to have thermal screening, it has to be for everyone.
Now let's come to the second part. Thermal screening was something which actually was made SARS detection actually effective. Not only at the ports of entry, but at the ports of exit as well. And that's what is crucial.
Are you therefore, as a former health secretary, surprised that Priyanka Sharma, who flew in presumably yesterday from Abu Dhabi, has told the Times of India there was no thermal screening at all at Delhi airport?
I'm surprised. I think it's time, if it is true, I think it's time, high time that thermal screening must be introduced as it was done in case of SARS.
Except the funny thing is, when I interviewed the last health minister, Mr. Harshvardhan, on the 24th of October, he assured me there was thermal screening. Now, he's being contradicted by someone who actually flew in and told the Times of India there was none. So it seems that either the minister was wrong or the thermal screening has huge big loopholes and people can pass through without even noticing.
I think that's something which has to be found out. I think it's necessary that that is put in place if it has been.
So this is something the government must look at and check up immediately.
Absolutely.
Dr. Bali, when you have thermal screening, the best it can do is to in fact identify people who have temperature.
Yeah.
But the problem is, by the time an Ebola carrier has temperature, he or she is already infectious. So what the thermal screening will do is identify an Ebola carrier, but it's quite possible the infection may have entered. Is that just a paper risk or is that a genuine risk?
No, it is a genuine risk also, because we know that the Ebola incubation period is from 2 to 21 days. So 1 day prior to that, 2 days and up to 21 days, anybody can be infectious. So if the person has fever, that means the person, and the fever is because of Ebola, that means the person is
already infectious.
Could be infectious, yeah, could be infectious.
All
if
the
it is
literature,
Ebola.
all the literature says that if you have Ebola and you have fever, you're already infectious.
Yeah, you're already
Not
infectious.
could be, but you are.
Yeah, if you have Ebola and you have fever, then you are infectious.
So if
yeah.
an Ebola carrier is detected because of the screening to have fever, then he or she is already infectious and it's a bit late.
Yeah, of course, it could be a bit late, but
The
then
point is, the public health practice and the drill is to keep him or her under surveillance. His or her temperature is measured twice a day and he or she has got to be visited. The point is that per se he is not infectious in the sense that it wouldn't spread through air, it will only spread through close contact.
With bodily
and that's critical.
fluids.
That's critical.
Now, in fact, that brings us, Dr. Trian, to this whole question of do we have the adequate capacity in place to monitor what I'm calling suspect cases. As you've heard, they need to be monitored for at least 21 days, which is the danger period for them. The health minister told us last month, then let me finish, then you answer. The health minister told us last month that the government has put in place a 4-member rapid response team in each state of the country, comprising a general physician, a microbiologist, an epidemiologist, and a nurse. Do you believe that is an adequate mechanism to monitor twice a day all the suspect cases that you have?
Karan, you must take a step backwards here. We are now talking about after the fact. The basic thing is that there has to be a full integrated alignment from the point of departure to point of arrival and travel in between. So if you have trained your personnel, all the countries put together, that to try and identify and locate people who may be the suspects in the sense of looking sick, sneezing, coughing, look feverish, and you can tell if you've trained the people enough, they can be the warning sign. The cabin attendants in the airlines can be trained to say, if you have somebody like that, offer them a mask. Offer them a mask.
But Dr. Trian, can I interrupt?
Actually put them in a more isolated
The problem is what you're suggesting would work perfectly if there was complete cooperation agreement across countries, including airline staff. But you don't have that international agreement at the moment between different countries. Secondly, passengers can come via third countries and fourth countries, which makes it more complicated. And finally, airline staff are airline staff. They're not trained medical professionals knowing how to handle someone who coughs and sneezes and raises the fear of Ebola. So let's leave that out. Let's start with the nature of the operation.
Listen, Karan, it's not such a complicated thing. You must understand there has to be a will to control it at every level.
But it's beyond the Indian government.
Has travelled for 12 hours on an airline.
That is beyond the Indian government to do.
Done to all the people who are in the aircraft.
Dr. Trian, that is beyond the capacity of the Indian government to do. Let's focus on what the Indian government can do, because that we can advise them on.
The second part,
come to the second part.
The second part you're saying is, yes, if you look at the advisory put out by the Government of India and the interministerial meeting that was held the day before by the current health minister, will make you believe that yes, there is a system mechanism in place. How well it is executed is the question mark.
Okay.
Now we were talking about thermal cameras, we are talking about making the staff more alert and not sleepy and just doing their stamping without looking at people. Of course, that needs to be monitored.
Okay.
Of course, there should be protective gear available for people who are going to be isolated.
Let's take it one at a time, Dr. Trian. Don't collapse all the measures at one go. I want to take it one at a time so the audience can understand. Pause a moment. You have suggested that you need much more effective screening at the airport. Let's come now to the next stage. The next stage is, in fact, the laboratories needed to test. God forbid you should hit, Dr. Dasgupta, the scary scenario of 10,000 tests required a week. We haven't got to that level as yet, but the WHO has said that you could be approaching it in some countries by the end of the year. Now, we've established 12 laboratories, so we're no longer just dependent on the facilities in Pune and Delhi. The critical question is, do these 12 laboratories have adequate equipment? And more importantly, do they have the required trained manpower? What's your answer to that?
Well, that's for the government to answer. I'm not one of the implementers, but
What's your hunch and feeling?
My hunch and feeling is that's achievable. That's not that's something not achievable. One of the critical things that go with it is you require a biosafety level 4 lab for disposal of the contaminated material, which is equally crucial.
And that has to be in place.
Yeah.
Do you
that's
think
part of the
I presume
package.
the laboratories would have thought of that, or do you think that's one of the areas where they may have failed?
No, it's fairly standard procedure. We have to grant that.
Now, the second challenge will be if you actually have a full-fledged Ebola case and how he or she gets treated in hospitals. The government has put up on its website, the government claims it has disseminated top quality protective gear. 10,000, the minister said, have been ordered and they've been sent to 18 different hospitals. But how confident are you that the designated hospital in each state has the capacity and the trained manpower to handle an actual Ebola case when it happens?
So till now, whatever policies we have made in our own hospitals, like I'm from Max Healthcare, we have made our own hospital policies based on the WHO, CDC and our government guidelines. We are not going to be treating Ebola cases in the private hospitals. Till now, this is which has been told.
This is interesting.
Any
Suppose
case,
someone comes to you
Yeah,
suspecting they've got Ebola, what would you do?
Yeah, so what we are doing and what we have already done at our level is that we are going to do the primary screening by a history and by basic clinical symptoms, especially by the travel history, by the history of contact, and then giving them the basic the basic treatment whichever is required, and sending them to the government authority, that is
Let's
RML
come then,
hospital.
Mr. Nanda, to the designated hospitals. Although the government claims they've been given protective gear, although the government claims dry runs have been done on how to operate the gear, and although the government claims all the protocols for treating Ebola patients have been shared and understood, are you confident as a former health secretary that these hospitals, many of which are in the states, not in Delhi and Bombay, can actually rise to the challenge when Ebola or if Ebola cases actually happen?
Well, I think the government, if they have really made them prepared for this, if they have not done, they should go all the way to make it sure that they are fully trained, that they
What would going all the way amount to? Can you specify what are the things you'd like them to do to give you confidence?
Yeah, they should be fully trained as much as they have trained RML hospital people here. I'm not sure how much the training is, whether they have followed the procedure that...
But the government says that the training has been given both in terms of WHO guidelines as well as the American Preventive Disease Center guidelines.
Yes.
But is there adequate time to do it? Because I take it this whole operation has been put into place in the last 5-6 weeks. Is that adequate time for the training required?
No, I think they should continue to do that.
They should continue with the training at top speed. You know, America, Dr. Dasgupta, must have some of the most advanced medical facilities in the world, and yet 2 nurses got infected with the disease when they had to handle Ebola patients. What are the chances the same won't happen in India, despite all the preventive training and protective equipment?
There is no point pretending that such chances don't exist. Generally, the way healthcare workers, despite protective equipment, the reason they get contaminated is often worn out gloves are not changed as frequently as they ought to be, and some bit of contamination occurs actually when you open the protective gear. There is a drill for opening the gear as much as for putting on the gear.
And we have to hope that these are things that have been drilled into the heads of all the medical staff who are going to perhaps deal with Ebola cases.
Sure.
Very quickly, Dr. Trihan, because we're running out of time. After all that you've heard, how confident are you that India is prepared for, God forbid, whenever the first Ebola case happens? How confident are you?
You know, you can never be confident in the sense that, yes, everything is perfect in place. But what I am saying is that, yes, a lot of dissemination of information and details by way of visuals and also printed material has been sent to all of us from the Health Ministry showing exactly what the procedure should be. So it is up to one. Like I said, it's a chain. It's a chain which starts from entry into the country and also people who may get admitted to the hospital being not knowing that they have something like a virus which we don't know which one it is.
Okay.
The main thing is the hospital should be prepared today, like we did in H1N1 and we did in SARS, is to have our special facilities which are negative pressure. That staff, a specialized staff in the hospital must be trained, and meticulous attention to detail.
Okay.
That every piece, not only from treating the patient, how to protect yourself,
one quick
and how
question.
to dispose of the materials is very important, and this should be a daily reminder to everybody.
Okay.
And I don't think you can
Dr.
be prepared enough.
One quick
you
question.
have to be
Dr.
doing it on a daily basis.
One quick question before I end the show. Max Hospital, as Dr. Bali has said, has decided they will not be treating Ebola patients. After doing initial clinical tests, they will send them to a government hospital. Will your hospital treat Ebola patients if they come, or do you follow the same policy, leave it to state government designated hospitals? A quick answer.
No, it is actually government policy that we should ship them to specified hospitals.
All right.
But sometimes you don't even know that somebody has Ebola, and if you discover somebody who's admitted in the hospital with Ebola, you must have the facilities of proper isolation, negative pressure, and proper trained staff. We have that.
All right.
So when
you answered my question. You have it.
And ship them to the hospital.
You've answered my question.
Yes,
you have it. You are in a position to treat an Ebola patient if one comes to you and you find you have to do it. I'm afraid we're going to have to end this discussion there. Ebola is a subject that has clearly worried a lot of people, but the one thing we've established is that it is wrong to claim that India got his first Ebola case. The young 26-year-old who came has been cured of Ebola. He does not have it, and no one so far has ever had a relapse of Ebola. It's simply that his urine and his semen continue to show traces, as was anticipated and expected. So India has not got its first case, but we can continue to debate whether we're prepared for it when it happens. My thanks to all my four guests. And there I end this particular episode.